Yeah, I put everybody put your dog in the video if you have one. If you don't. If you have a cat, put the cat. I think today is our Cat's Day. Anyway,
Or
so
bird or
there's a lot
fish or
of
whatever you have.
I have a lot of good news, good updates. WHO basically saying that the pandemic is nearing the end. They said that we're not kind of fully out of the woods, but they're basically saying the current variants, the mild variants, are not necessarily showing in new mutations. There probably will be some, some potential shifts to new variants in the future, but I found that article very helpful. I'll post this a little in a couple of minutes into the chat if you want to read the whole statement. So that's one good news. And that's actually at the same time that basically now monkeypox is declared to be no longer an emergency because the numbers are going down and it seems like it's really not going to be a big of a deal. So those are some good news. The vaccine, the new vaccine that's been rolled out, I think a week ago, 2 weeks ago, something like that, pretty much available everywhere. I have not had a lot of my patients tell me they had problems getting it, those who want to get it. So in my understanding, and anybody who have other opinion who've heard this, please correct me, but everything out there now, all the boosters are 4 and 5. So they actually, I think, destroyed all the old boosters. So they're not even, you don't even have to worry about getting the old ones. So whatever you're going to get, if you are going to get one soon, you will be getting the new one. I think I mentioned that last time. The way I'm positioning the timing of the boosters, if you are to get the booster now, I do recommend that you don't get the booster very close to the flu shot. I'm a big proponent of not doing too many vaccines at the same time. So remember, usually I recommend flu shot mid-October for those who qualify. And so you basically have between now and let's say 1st of October, or maybe even a little bit before that, maybe the last week of September, to get the new COVID booster if you choose to. I'm still carefully looking at the data. I mentioned last time, I think, that I'm going to start recommending the boosters once a year. I think I'm going to stick to that for now. However, getting the first 4 and 5 booster is a little different because the 4 and 5 are so different from prior versions of Omicron that it's okay to even get that booster within 6 months. And only last other thing before I take questions I have is I'm starting to track a little bit more aggressively statements of some toxic effects and some of the reports. For example, Harvard group has published a study last week basically saying that for young adults who are completely healthy, so they define that category of people are 18 to 29, they're saying that the value of booster for Omicron appears to be so low that they don't even recommend it. And because the chance of a heart inflammation, what's called myositis, is low, but actually exists. And for now, there's been several thousand cases described. Basically, they're saying morbidity now even not justifiable because that complication, even though nobody died from it, but actually can carry long-term consequences of weakening of heart muscle in the long run. So there's not all patients 100% recovered from the myositis. So that's kind of I have not seen data reported for older adults. I think that the value of vaccine is still undisputable in my opinion, but I think we have to keep track of the vaccine safety continuously. And also that is one of the reasons why I don't think I'm going to recommend frequency of the shots to be going forward more than once a year, exactly the same as with flu. And we started long COVID group. We had 2 sessions and so far so good. If anybody interested in those groups, please shoot me a message. And I'm happy to share the information with you. So with that,
or if you know someone who would benefit from it.
Yes, Yeah, you can do it. This group is already formed. I don't think we'll take new people, but so far it's been received very well. So we're probably gonna start the next one pretty soon after we finish this 8 weeks, so 6 weeks from now. Okay, so I'm going to start with the first question. And yet I'm hearing, so correct. So the great question, is it really over? I think what WHO is saying is the pandemic is over. So the pandemic has certain definitions, right? So the fact that the COVID is not going anywhere, that is most likely. But if it's no longer a pandemic and we have periodic sporadic cases or flares here and there, and we know how to handle it. But that takes us to exactly what else put in the chat is now, what about long COVID? Especially since I did tell everybody that it looks like that the chances of long COVID are not necessarily a lot better with Omicron. I actually don't know whether the 4 and 5 data was included into the analysis that I presented a couple of weeks ago on my YouTube channel. I think I posted that last time, but I can repost. That was the large analysis of done in Lancet Psychiatry, it's an English journal, British journal, basically saying that upwards of 20% of all the patients are going to have some cognitive difficulties after COVID. So we just don't know whether Omicron 4 and 5 are going to show the same. My kind of feeling is that no, that it's going to be somewhat lower risk. I think the newest variant, we're seeing a lot of people catching it, and I'm definitely not seeing 20% people having long COVID. But again, my experience is biased by, of course. So I totally accept that this is potentially an issue. Okay, if you need both flu and new COVID, which first? I think I already answered that. So I would suggest, since I don't recommend getting flu shot before mid-October, since the risk is so low and you want to carry over the vaccine as far as possible into the spring, and because it doesn't last for more than 6 months, actually it lasts a lot less than that. You want to try to get the flu shot a little bit later. Like, I don't never recommend flu shot in September. It's just, it basically means come February, you're probably completely unprotected. And actually a lot of people get flu after they get a shot in the spring. So get it a little bit later. So if you get it in mid to late October, then you probably would want to get your Omicron booster now. So then you split them up. Okay, October. Okay, very good. So what is the age cutoff for the heart? There is no age cutoff. It's described as primarily in young adults and teenagers with, for some reason, men, boys are more prevalent risk. But I don't think there's any specific cutoff. The cutoff I mentioned, that was the study cutoff. So they only looked at the young adults 18 to 29. That doesn't mean that the risk of heart inflammation ended at 29. That's just the population they looked at. Okay, got second booster June 10. So you can't rely on Elizabeth. You can't rely on the data for the old boosters because the old boosters were quite ineffective, and I'm not sure if you remember, but I actually was not recommending it to a lot of my patients because they basically stopped working against Omicron. And so we have to yet to see what efficacy of the new one's going to be in the long run. So I don't think we have a data on that. So I'd say we have to wait. Is COVID now considered seasonal? Oh, now that's a great question. Well, this person never asks not great questions. So, okay. Benita. I don't think so yet, but I think that's what the head of WHO was kind of stating, is like it's going that way. It's going like it's going to be a seasonal thing. But I don't think yet. I think the way it transmits itself probably not going to be necessarily seasonal. It's probably going to be a one of those categories where you have a constant low grade infection in population circulating with an occasional spikes, depending on characteristics of the given variant, and also the proximity and indoor factors and change in climate, things like that. If we had adverse reaction for the first, okay, that's a very complex question. I don't think I can answer that because it depends what complication, adverse reaction you had. It depends what vaccine you had. It depends on whether or not that reaction was more of an inflammatory reaction that can be controlled. If it was a strong allergic reaction, which is somewhat different from expected inflammatory response, that is different. So I don't think, Benita, I can answer that part. Mixing and matching, I don't recommend it for the new variant because there's no data for now, but I'm not recommending against it either. I'm completely neutral to that. So make your decision. For flu, boy, there's a lot of questions. Okay, how about we'll take 2 more questions. I don't want to go past 2:15, okay? So Al's question is the last one for now. If we get time at the end. Actually, I won't be here at 3, so that would be the last 2 questions. So for the flu vaccine, for past 2 years, I have decided Fluad was preferred to Fluzone. It depends on your age. It also depends on your personal immunity. So the high dose quad, which is what Fluad is generally recommended for older adults or people at the high risk. You have to make sure, though, that it is covered. So there is also some issues, since one of them is more expensive than the other. You want to double check to make sure your insurance covers it. That's how I'm going to answer that one. Yeah, so I have to kind of follow a standard Rex. So if you're a healthy person under 65 and you're not in healthcare field, the flu shot is not recommended because the risk of complications is exceedingly low and you're not going to theoretically infect lots of people. So, but I do have to just follow. And since my practice is geriatrics, I usually recommend it to most of my older patients. And with that, I'm psyched to have Dr. Sharon DeMocker to be our guest speaker on wellness. And Dr. DeMocker has joined our clinic now. It's getting close to a year, I want to say.
Mm-hmm. Yep.
We're super excited. Before that, she was running a war-related serious injury center. I'm probably butchered that one, RISK. She can tell us exactly what that is, which is a kind of I call it the Mayo Clinic of the VA Center. And we're very happy to get her because that program is very prestigious and she decided to join us. So thank you, Sharon. And I'm going to mute myself.
And I'm having some trouble with my internet freezing intermittently, so let me know if that's a problem. It's freezing for 3 to 5 seconds at a time.
So far, so good.
Okay. But yes, I have been heading up a team at the War-Related Illness and Injury Study Center at the DC VA since 2015. And for that, we are helping evaluate veterans who have unexplained illnesses. So we're kind of the mysterious illnesses team, which has been interesting. Before that, I founded a clinic about 20 years ago in the Asheville, North Carolina area after I trained with Dr. Andrew Weil at the University of Arizona. And so it's been great to be part of the GW sleep problems and insomnia. So if you're having trouble sleeping, then you are definitely not alone. About 1/3 of the adult population worldwide.
Yeah, Sharon, we are having
trouble sleeping, at least at times.
There are periods of freezing. They're kind of in and out. So I think we could try to continue, but just so you know.
Okay. Yeah, I don't know if it would help to do, maybe I should have set up the PowerPoint. But I can kind of slow down and back up if it's freezing. I'm not having much luck with some of the remedies I'm trying here. But So
about
let me
turning
know
off
if it's too
the video?
problematic.
Sharon, turning off
I can
the video.
certainly do. I can try that. Okay, I've disappeared. So does that, although I'm still seeing, okay, now that's better. Dr. Kogan froze for a moment. So are you still hearing me okay? I'm not hearing.
Yeah, no, it's a little better. Yeah, it's better, definitely.
I'm still seeing Dr. Kogan freeze some. So
Sharon, it's a little bit better.
all right, well,
Let's try.
Okay, well, let's try that. So insomnia, it's a little bit more common in women, but sleep quality does tend to decrease a bit. How much sleep do you need? Usually we're recommending adults need about 7 to 9 hours a night, teens a couple of hours more. Everybody's individualized, but unfortunately, the average American is now getting about 6 to 6.5 hours sleep. So most folks are simply not getting enough. There are medical causes and legal causes. Then depression is one of the most common reasons. Anxiety is also a factor because sometimes folks have trouble winding down in order to get to sleep. And in fact, anxiety about having trouble getting to sleep. Pain can cause frequent awakenings during the night. Sometimes then people have trouble getting back to sleep. Some conditions such as sleep apnea and syndrome can disrupt sleep and cause unrefreshing sleep so that folks will wake up in the morning and still feel tired. Also, overactive bladder or benign prostatic hyperplasia. BPH, that can the restroom, and conditions such as heart failure or asthma can make it hard for some people to lay down flat and be able to breathe comfortably. So some of the lifestyle things that impact sleep quality are stress about not being able to sleep. Using screen time too close to bedtime can be a factor. We found that the blue light that comes off your computer or tablet or iPhone, smartphone, actually can interfere with proper sleep. A lot of folks aren't aware that the half-life of caffeine is several hours. So if you are still drinking caffeine after noon, it may not have all cleared out of your system by evening. And some people are faster, but that's something to keep in mind if you're finding that you're having trouble falling asleep. Drinking alcohol before bedtime can make a difference because alcohol tends to make people feel more sleepy, and so they might initially get to sleep hours later. So, and it actually disrupts the what we call the architecture or pattern of your sleep. So that's something you want to watch also. Tobacco use can interfere, particularly late in the evening. So having a large meal, particularly a fatty meal close to bedtime, can impact things because then your GI tract is trying to rev up and get to work just when you want to slow down and go to sleep. Is excessive napping during the afternoon or evening, or disruptions in your sleep-wake patterns from family life, work schedules, etc. We found that the average set of new parents loses about 200 hours. That's a common issue. So sleep deprivation has fairly wide-ranging effects for folks throughout the body. It impacts inflammation and tension. So particularly as we're going into the cold and flu season, then you want to make sure that you're getting enough sleep, particularly as we come up on the holidays and people tend to be more stressed, get less sleep. So pulling weight can be more difficult if you have chronic sleep deprivation, because the hormones that control your appetite are actually altered. And so it tends to increase the desire for carbohydrates as well as high calorie food. Lifestyle issues in a moment, but some of the ways that we're evaluating the medical causes is looking at common things like sleep apnea. There's a really simple screening tool that you can actually find us online. We call it STOP. The details on that in a moment. But this quick 8-point quiz is about as helpful as the ones that we used to use, and some sleep specialists still do, for evaluating your risk of sleep apnea. Just the 8 letters. You can pull it up online. So this screening tool, if you have more than 3 yes answers to these 8 questions, then you have a high likelihood of having sleep apnea. So the first one, S, talking or can even be heard through doors, then you get a point for that. If you're tired, fatigued or sleepy during the day, then that's another point. The O is for choking or gasping during the night. That may indicate sleep apnea. The P and stop is for blood pressure or hypertension. So for folks that have that, again, that's a risk factor. The bang, so people that are up in the overweight or obese class, then that is a risk factor. The A is for age, over 50. Those of us over the age 50 get there. The N is for neck. So if you have a neck circumference greater than 16 inches, that can be an increased risk factor. And the final one, G, is gender. For male, if you are a male, you get an automatic point. So just 3 of those points means that you have an increased apnea. Then it's definitely something you want to treat because it has impacts throughout the body. It is a risk factor for heart disease, for elevating blood pressure, as well as blood sugar. It tends to contribute to dementia, which we're all worried about as we get older. It's an increased risk of some of the neurologic diseases, including Parkinson's. So what are the treatments? Typically, it has been CPAP machines that blow, but more recently they found that some of the other options, such as oral appliances that will actually shift your jaw in such a way that it tends to keep the airway open. And that works for a lot of folks. And many people have found that that was easier or to tolerate than the CPAP machines. Occasionally, it's for surgery. Most people are not, but that's something we always keep in mind because some people are just genetically built with a very tiny airway. And hopefully this is still working because suddenly my screen has changed. So what are some of the lifestyle changes that we use? First and foremost, try to set up a consistent bedtime routine. So this is one of the most important things. So you want to be going to bed at the same time and getting up at the same time in the morning, even on the weekends. Having a bedtime routine can be very helpful for kind of setting the stage for good sleep, letting your body know that it's time to wind down. And get ready to sleep. So some of the routines are things like having tea. I'm a fan of some of the things like sleepy time tea or cup of calm. Some of these herbal teas that tend to have a relaxing effect on the body. Chamomile and lavender. Some of those types of herbs can be very relaxing. I've had patients say that they got so used to using the herbal tea that even when, so having a good bedtime routine can help. A warm bath can be good, or doing some stretching or meditation or relaxation exercises are all good ways to help wind down and set the stage for good sleep. People who are physically active tend to sleep much better than those who are sedentary. So basically, the more energy you expend during the day, the more sleepy you're likely to feel at bedtime. As we mentioned, you want to avoid stimulants like caffeine, tobacco earlier in the day. They can still affect your sleep. You really want to keep your bedroom as a relaxing place. So the bed should only be used for sleeping and for sex. So don't use it for work or watching TV. Or what's really common now is, and then they're on the iPad or on a smartphone. You want to avoid large meals or late in the evening, as I mentioned earlier, so that your GI tract is not trying to work. And if you find that you can't fall asleep within about half an hour, or do something calming until you feel sleepy, and then try going back to bed again. It can be very helpful to learn some type of relaxation technique. One of my favorite breathing exercise, like the 4-2. It's on Dr. Weil's website, drweil.com. Or if you just put in 4-7-8 or relaxing breath, it should pull up. And I'll go into more detail at the end if we've got time. Meditate body and set a good state that's conducive to good quality sleep. We've used acupuncture. That's been shown to improve sleep and is getting easier for most people to access. Improve a lot of the symptoms that impair hormone levels or adjusting sleep-wake cycle. So that's another tool. There's a lot of white noise devices that can help block out some of the environmental sounds. You can find a lot of free apps that offer that as interesting noises. You can get oceans or crickets or just kind of the sound of rushing air, something like that. And so for many people, it's very helpful just to have that to block out noise. You want to make some of paying attention to some aspects, like, is your bedroom dark enough? It's really good to have the room as dark as possible. You really don't want to be exposed to light. Is the mattress comfortable? If it's been more, it'd be worth looking at getting something a little bit more updated and comfortable. I mentioned taking a hot bath or shower before bedtime. You can even add drops of your favorite oil, like a lavender oil. But as the body cools, the cooling is actually the trigger for your body to slow down and go to sleep. So that the cooling is good, having the bedroom at a temperature ideally 65 degrees or less again. I know we got in the 50s last night here in DC. And so you want to make sure that the bedroom is cool enough to really have good sleep. Short naps during the day are fine. Trying to limit that to about a 10 to 20 minute power nap can be helpful. And spending some time outdoors every day to get that light, bright sunlight, is very helpful. In the evening can be very helpful for a lot of folks. We've often had them dim the lights as the evening went on, and in the bedroom to keep the lights fairly low. Some of the sleep aids that we've used are things like melatonin. I think most people have heard of that. It's easy and inexpensive to find over the counter, and using a sublingual or under the tongue tablet, and many folks have good effects with that. And lastly, we tell people, make sure you're not obsessing about sleeping, because again, a lot of folks worrying about falling asleep is what causes them to remind yourself that, well, not sleep, having trouble getting to sleep is bothersome, but it's not life-threatening. And there are ways to improve your sleep. I might be running over, in which case then I'll just put a link to the breathing exercises. Are there questions? A good comment from Al about air purifiers. There's some great ones that are very helpful for adding white noise. And thanks, Jennifer, for the circadian rhythm article. New York Times, that's a good link. If there's no specific questions yet, go ahead and toss them in the chat box if you have any. Then I'll just go ahead on the breathing exercise, because I particularly like this tool. It's something you can use during the day. We have folks who are dealing with stress or even panic attacks, and it's very effective for quieting the brain down very quickly. Also found that when folks are trying to use it to fall asleep, it's a great tool for retraining the brain. And it helps when you first start doing it, but the real strength of it is when you start doing it, your brain starts recognizing this pattern. And after you've been doing this, then luckily our brains are pretty smart and teachable, and it notices you're doing that pattern again. And so it tells us, okay, this is not time to get all stressed. This is not when there's suddenly a bear that came into the cave. This is when you're hanging out looking the pond. This is your relaxing time. It's just time that for you, that where you can just hang out comfortably and be in bed. And it sounds like the audio is still choppy. My apologies, not been able to fix that. I will put the link in the chat box too, so y'all can see this. But the breathing exercise, we call it 4-7-8. It's a deep, but it's a little slightly different because you're breathing in to the count of 4. You're holding your breath to the count of 7, and then you're breathing out through your mouth to the count of 8. And so you're breathing out twice as long as you're breathing in. So if you're breathing in, time that this takes, this is up to you, whatever your comfortable breathing speed is. Some people will tie it into their pulse, but whatever is easy for you to breathe. So breathing in to the count of 4. Holding it to the count of 7. I'll let you do that mentally. 6, 7, and then breathing out with a swoosh through your mouth to the count of 8. So it's And that's one breath. Now, when we have people using this during the day, we tell them just do four breaths when you start doing it. And the reason for that is we don't want people getting lightheaded. When we've been under stress, your chest wall tends to be tight. And when you start doing a lot of slow, deep breathing, some people will get lightheaded. And we don't want anybody passing out. But if you're lying in bed trying to get to sleep, you are welcome to use this as passing out in bed. That would be a nice side benefit. And so that's a very simple but deceptively powerful tool. So I'd highly recommend doing that. Again, when people get used to it, this is your time to actually slow down and go to sleep. It's very easy. As adults, we start getting into bed, it's suddenly quiet, it's dark, and all those things you've been thinking about or putting aside all day suddenly pop. This is what you got to do tomorrow. It's our sleep specialist out at Dr. Wild's clinic called it popcorning. So he said it's interesting, these thoughts are flying, and so we tend to follow them. It's more interesting than just falling asleep. But it turns out we're also not good at all at solving problems late at night. And so I think it's helpful to just remember that and say, okay, I'm going to take, and it's time for sleep. And that's where I think this breathing exercise can be very helpful. And I will step off because I think I'm running over time here. If there's any questions, otherwise I will put the relaxing breath link in the chat box. And thanks for your attention.
Thank you, Sharon. I think that's
turn this over to Nina.
I think that's a good segue into Nina.
All right. Well, it's wonderful to be with all of you in this community. And thank you, Sharon. Thank you, Janet. Thank you, Misha. I'm always learning so much in this program every Friday. So I just want to mention my role at GWCIM. I'm the MBSR teacher, mindfulness-based stress reduction, and I also offer mindful coaching services, and I teach mindfulness courses at George Washington University at the Department of Public Health. And incidentally, we have GWCIM has the fall 2022 8-week MBSR programs starting next week. So MBSR is one of the most evidence-based mindfulness programs out there, and it was developed by Dr. John Kabat-Zinn at the UMass Medical Center back in 1979. He offered it to chronic pain patients and other patients there that were struggling with illness, and they found it to be highly effective for their patients. And out of that program was born the 8-week evidence-based mindfulness-based stress reduction program. So it's one of the best ways to thoroughly learn the skills of mindfulness, and Janet will post the link in the link to this program. So if you want to learn more about it, there's also a free orientation coming up next week as well, offered by myself and a fellow MBSR teacher at GWCIM, Cynthia Powell. All right, so joining or actually going to the mindfulness meditation now. Mindfulness is a highly beneficial mind-body state that we all possess, and we can increase and strengthen our mindfulness muscle by practicing mindfulness meditation, where we're paying attention to our present moment experiences with attitudes of openness, kindness, and curiosity, to whatever may be arising. And so with that, I'm inviting you now to sit in a posture that works for you so that you're feeling alert and relaxed as best you can. If you're sitting, you could also be lying down. Start to notice your feet making contact with the floor. As a way to ground yourself, you can notice the feeling of your legs and buttocks making contact with the seat of the chair or the cushion. You can have your eyes open or closed, whatever is most comfortable for you. You can start to notice the feeling of your hands, perhaps resting on your lap or resting on a different surface, and maybe start to relax and soften the hands. And start to bring your shoulders down away from your ears. Maybe you want to shrug your shoulders a few times to release any tension you may be carrying here. You can now bring awareness to your jaw, so you can relax and soften the jaw. Soften the eyes and the eyelids and the forehead as best you can. Bringing awareness now to the entire body, so getting a sense of your whole body sitting here breathing. Perhaps feeling the expansion and contraction of the in and out breath. And if you like, you can take a few deep, calming breaths. You can take an inhalation now through the nose. Long, slow exhalation out through the mouth. And again, breathing in through the nose and out through the mouth. Let it go. And then returning to the natural rhythm of your own breathing. When you're ready, and bring your focused attention now to hearing sounds. You can notice the sounds inside and outside of the room. Sounds coming and going moment to moment. Resting attention and hearing sounds, letting the sounds wash over you. As best you can, as you're focusing on sounds, letting everything else drop into the background of your awareness. You can ask yourself, what am I hearing right now? And see what arises. And nothing has gone wrong if your mind starts wandering off into thoughts or other distractions. It's perfectly natural. You can note that silently as thinking, or wandering, and then Just gently and kindly return your attention to the anchor of sounds. Over and over again, that's the essence of the practice. And then taking attention, focused attention from sounds to noticing your thoughts. First, you can just get a sense of the thought traffic in the mind. Does the mind feel very busy and full of thoughts, or quiet and still, or somewhere in between? And to get more specific, you can ask yourself, what am I thinking right now? See what arises. Getting a sense of stepping back and observing thoughts as if you were sitting on the bank of a river and your thoughts are like leaves floating by. Noticing them, letting them be, letting them go. I'm not trying to suppress or change the thoughts, just allowing and letting them be, observing them as best you can, moment to moment. And then letting go of focusing on thoughts, you can bring your focused attention now to whatever you're feeling, tuning into any emotions that may be arising. You can ask yourself, what am I feeling right now? Giving yourself the space to just see what arises. There may be feelings of boredom or restlessness, peacefulness, calm, irritation or sorrow. Whatever is arising, meeting that with kind acceptance and curiosity. And if you can, identify the emotion, giving it a name, a label. And so just cultivating this capacity to become aware of any emotions arising. Letting the feeling of any positive emotions sink in and meeting any difficult emotions with compassion and kindness. This is what's here right now. And then taking attention now from observing and feeling emotions back to the breath. You can choose an anchor spot to focus on the breath. It could be your belly or your chest or both. tip of the nostrils, or a sense of the whole body breathing. So just feeling the breath sensations, the movement of the breath as it comes in and as it goes out, moment to moment, breath by breath. You could put your hands on your belly or your chest as well. It's a way to really feel the movement of the breath and center yourself. So resting awareness on the breath as it comes in and as it goes out, moment to moment. I'm not trying to change the breath in any way. Not trying to achieve anything here. Just letting it be. And now open up the lens of awareness to include sounds, to include feelings of body sensations, whatever else may be coming into your awareness. And in this last part of the meditation, I'm inviting you to call to mind something in your life you're feeling grateful for or really good about. Expressing that gratitude, feeling that sense of appreciation for any goodness that's in your life. Taking that in. And it's as one of my favorite meditation teachers and psychologists, Dr. Rick Hansen, says, it's good to take in the good. And gently bringing the meditation to a close whenever you're ready. Gently open your eyes if they're closed. And gently transition your attention back into the room, the Zoom room. Welcome back.